Welcome to the Fed to Fed podcast, where we dive into the dynamic world of government technology. In this podcast series, we'll be joined by current and former federal leaders and industry trailblazers who are at the forefront of innovation. Here, we speak openly and honestly about the challenges and opportunities facing the federal government and the Department of Defense and its partners in the modern age, driving innovation and the incredible capabilities of technology along the way. Whether you're a federal leader, a tech industry professional, or simply fascinated by IT modernization, just like us, this podcast is for you. And we're so happy to have you tuning in. Well, Kim and Kevin, thank you so much for joining us today.
We're thrilled to be here.
Yeah, it's great to be here.
Wonderful. Well, why don't we go ahead and jump right in? And Kim, I'd like to start with you. And let's talk about the big picture. Can you walk us through the strategic vision behind crushing fraud? How has the approach evolved over time? And what key shifts have defined that journey?
So it's a great question, and it really has been a journey. I think that's the best way to put it. So Dr. Oz came in last year with a goal of crushing fraud, and we had already been starting to work on a lot of things to try and take us from what I would call a really good adequate, fraud detection group within CMS to sort of what we're hoping will eventually be best in class. We want to be the people that everybody else wants to follow, and we're getting there. But to do that, it's required a number of things. The first was moving away from that pay and chase model. For so long now, the goal has been, let's try and do all we can to, recover monies after they've already gone out the door. We only get about 10% of those. That's not particularly effective. So what we really did was change our mindset to how can we go to stop and caught, or as I like to call it, detect and prevent, which is what Kevin and his team do. And I'll let him talk more about that. But so as a result, we put our focus on how could we do more? How could we focus more on claims as they were coming in? In the past, we reviewed the claims after they've gone out the door, but we thought, what if we just shifted the whole paradigm and just put more of a focus and focused not only our analytics, but our resources to that front end? And it's been slow and it's been hard, but since March 31st of last year, when Kevin and the team took over and started this approach, they have been able to stop over $2.1 billion from going out the door. The dollar amount's even higher than that now, I'm sure, but that's our last recorded number. And they've been able to take action against over 430 providers. That's significant. Those are big providers, big dollars that have been basically otherwise would have been lost to the government. But in this case, we were able to stop it on the front end. The second way we've been able to do that, besides just thinking about how we approach this, is looking at what are the tools that we can use to do that. And thanks to the team, we have been very strategic over the past year and a half about the types of approaches and the types of tools. We've had the chili cook-off, where we had over 250 different entities come and tell us what they could do and how they could do it, to make sure that Kevin and the team knew the full range of possibilities out there in terms of what they could use and who they could use. And then as a result, we had 10 people that were finalists, and then obviously Milliman won with some really creative approaches that they had. But what was great about that is it allowed Kevin's team to be able to see, were they missing anything? Was there something some silver bullet out there? It turns out there is no silver bullet. There's just a lot of really good tools. And so it's been up to Kevin and the team to sort of figure out what that suite of tools is, which honestly is ever evolving, that helps us through agentic AI, machine learning, all the things to be able to get on top of the fraud. And then lastly, it was that whole of government approach to this that we are now seeing through the task force with the vice president, which is, this is not just us working alone. We are now working in real time with the Department of Justice, with the Office of Inspector General, with the FBI, our other partners, Kevin and his team in the war room that they have, which, makes it sound as though he's got like some top secret cabal somewhere, but it's really just a virtual war room of a bunch of them coming together. They can actually decide how we can best approach this, versus in the past, some of these things would take years to bring to fruition. And now, because of our current approach, they can take action on, and we can actually shut down a bad actor within weeks, whereas before it would take years. And so to me, it's that combination of we sort of rethought how we were going to approach it. We figured out what the tools were and the new abilities that we had to approach it, and then how to effectively partner to get at it. And all of that is what's really shifted us to getting event. We're not quite there, but I think we will by the end of the administration be best in class for this.
That's fantastic, Kim. Thank you so much for sharing that with us. So, Kevin, let's hand it over to you. Thinking back to your first year, what were some of the standout accomplishments, especially around the FDOC and other early initiatives?
Yeah, first, thanks, Susan, for inviting me on the podcast today. Super exciting to share our successes with your listeners. And also, it's just great to be sharing a venue like this with Kim Brand. Kim, we're just so grateful for your leadership around CMS and all that we've been able to accomplish over the last year and a half. And it has been a super great year. I don't come from a health insurance background. I'm a West Point graduate, spent 24 years in the Army and multiple overseas deployments. But I went back for a PhD in biostatistics and then spent the second half of my career doing research in health and teaching data science and machine learning. And as my Army career kind of came to a close, I really wanted something at the intersection of public service, health, and data. And this opportunity came available, and it was like amazing. We have a great mission, a great team here that's super focused on helping the American people. Our leadership at the Center for Program Integrity, Janina Wugo, Jen Dupay, Larry Young are amazing. And I feel very fortunate to have landed here. So Susan, you mentioned the FDOC or the war room, so I'll start there. It was a great initiative. As Kim said, we started in March of 2025, and it was a fundamental shift. Like, it was a fundamental shift, a really different way of doing things, from going from a reactive approach to being proactive. First, we brought the right team of people together, and we leveraged the technology that we had at the time. It's like that old expression, like you go to war with the army you have. Like, we went to war with the technology we had, and the technology was really good. We just needed to bring the processes together. And like, I think when I came, I was like, wow, we got really good technology. We can improve upon it. We got great people. If we can just get the processes and the culture right, this thing is just going to take off and explode. And that's what it did. We brought the data analysts, the investigators, policy experts together. And Kim mentioned the results, but I just want to underscore them again, like over $2 billion, payment suspense to over 200 providers. And this is real money that was about to go out the door. It's not like some clever accounting trick or something. Like, this is money that was set to be paid on a date from our CMS coffers and was stopped. Like, this is hard dollar savings, and I think is a really great contribution. We've since extended this effort to Medicaid, and like the Medicare one is like, it's like getting started there, right? And then scaling it up to Medicaid, where it's so much more complex because of the individual programs and states. We're having some great initial successes there, and are looking forward to continuing those. I do want to thank just a couple of people. Bethany Messick was amazing in getting the war room. I mean, she's just the one that knows how to manage and get things, the processes straight, and get down to the minutia of how you get people to move and change and initiate. And then now it's just been taken to a whole nother scale by Sam Pittenger and Alexandra Davenport, along with our colleagues over in the fraud investigation group, who've been tremendous partners in this effort. Susan, I could go on and on forever on this because I'm really excited about it, but maybe I'll turn it back over to you for the next question.
You bet. So let's talk about the success, failures that you encountered. What worked, what didn't, and how have those experiences shaped the current strategy?
How about I talk big picture about, because one of the things I really wanted to make sure that we hit on today is the success. So, we talked about shifts and approaches, and Kevin's obviously talked about the war room, which has been a big part of this, but just in general, our overall approach to how we do things, being more aggressive on our administrative actions, using data analytics better, being much more vigilant in sending feet on the street out to verify whether people are legitimate or not. It tells the story in and of itself. In fiscal year 2025, we delivered $41.9 billion in program integrity savings. That's a 59% increase over the prior year, which means our return on investment, or ROI, is $22.3 for every dollar invested. And that is the highest ROI ever recorded for CMS. And then 68% of those savings came from the things Kevin was just talking about: cost avoidance, things like revocations, automated claim denials, prepayment controls, not recoupment after the fact. And I just want to, when you talk about success, I just want to double down on that, because we are incredibly proud of those numbers. And it's thanks to the efforts of not only Kevin's team, but the overall approach that we've used across program integrity. And part of that was learning that some of our old approaches just didn't work anymore. And we needed to shift to newer and more aggressive approaches to do it. So doing things like revocations and making public our revocations, which you can now find online, which you never could before. And, making it so that we did more suspensions, and we weren't as, before we were always like, oh gosh, are we going to get sued? Should we suspend? Should we not? We've suspended 852 hospices in LA. We're getting sued by a bunch of them, and that's fine. But at the end of the day, that stopped over $1 billion from going out the door just there. So I think it's that risk tolerance that's really helped us to be able to be more aggressive. So sorry, but Kevin, you should take over from there in terms of the specific FDOC. But I did want to just give that bigger picture perspective, because I think that's important as we talk about this.
Yeah, that's great. Again, I think there's a specific initiative too that fits well within what you're just saying, which is our approach to claims editing. Because claims editing is a bread and butter of program integrity, right? It's a rule that denies or rejects a claim up front based on various different things. And the ROI on a claims edit is huge, because you're stopping the money before it goes out the door, and you're not trying to chase it back later. So we're changing the culture, improving our technology. We've taken a very different approach to claims editing. Through this approach, and really from a technology perspective, what we did was we had risk scoring through our machine learning models. And those risk scores were producing a lot of intelligence that we could then take that intelligence and feed it back and create claims edits out of it that stop things up front. So it's leveraging something going on over here in the organization to help a different part of the organization improve their intelligence. We put those claims edits in place, and have since that initiative in January 2025 stopped over $1 billion. One edit alone in the last 3 months has stopped over $64 million. So hugely impactful effort, and shows how all of these things, resources, culture, organization, and processes, are coming together at CMS to improve our outcomes. Susan, maybe I'll turn back to you to steer the next question, but there's so much more I could say in this area.
That's great. So you set the foundation. Talk a little bit more about the innovations that you're looking to bring to the table.
Yeah, I think Kim said it best recently. She said we're looking for better data, smarter tools, and more authority. And I can talk about those from my perspective. I'm sure Kim has some great thoughts there. But I think the first is to create an ecosystem where we are doing this that is modern, connected, and it's intelligence driven. We have great systems, but the goal right now is to connect and optimize those systems. We're accelerating the adoption of AI. We do have an AI innovation lab that we're enhancing the output of that. And we're also aligning all of this with the other initiatives in the CMS health tech ecosystem. I could talk specifically where we're going in terms of AI. We have a lot of great capabilities already that we've been leveraging for years through the fraud prevention system, machine learning models that risk score providers, and that helps our analysts find the most risky providers out there. But then taking all those data from different systems and building intelligence on top of that through AI agents that make the roll up your sleeves kind of work that investigators do faster and more productive, and they can move quicker through these things and process more actions. Essentially, automating while keeping humans meaningfully in the loop, very time-consuming processes. I think there's some other very interesting capabilities out there that we're quickly investigating and moving on, specifically in the realm of low code or no code ways of producing edits, enhancing our risk scoring, building AI tools on top of our existing data, and also enriching our risk scoring with additional data sets where, I think a provider's risk is really a function of what they do in our system and what they do outside of our system, and leveraging both of those data sets to their full extent to get a full picture of what providers are doing both in and outside of our system.
That's great, Kevin. Thank you so much. So Kim, let's shift into ClaimScore. Can you talk about how central that effort has been to the fraud strategy at CMS?
So we're so excited about Claims Core. I think probably if you would have asked either Kevin or I a year ago, one of the things that we thought would be the most helpful to help us to really push things forward, it would have been, gosh, it would be great if we could get Medicare claims data onto the cloud, off of the mainframe, be able to be more agile, really, and then to be able to think about how it is that as we build that system, to actually then integrate all the great stuff that Kevin and his team have been doing tool-wise into it. And that's what we have the chance to do here with Claims Core. As you saw, we just announced the first contracts on Claims Core, which is very exciting. Big props to the entities that won those contracts. We already had partnered with some of them, so it's going to be exciting to see what they continue to do. But to me, the greatest piece of this is the fact that now we really are going to build a better mousetrap. When the current claims processing systems were built, it was 1965. It was a very different day. We were coding in COBOL, we had mainframes, all the things, but now we have the chance to really be able to think about how to integrate agentic AI and machine learning and a lot of these other tools into this whole process to help it so that Kevin's team, I don't want to put them out of a job, but I want to reduce their job a little bit, because if we do it right, what Kevin and his team are doing is going to help actually create the ecosystem in which we have the potential to just really review claims in a big way. Just to put it in context, and then I'll let Kevin talk on this, every day while we're sitting here, Medicare pays 4.5 to 5 million claims worth over $1.5 billion. So every day, 4.5 to 5 million claims. Of those, we review, even with our new tools and stuff, less than 3%. So think about that. We just don't have the chance to really, the volume, the totality is just too much. If we can get it with these new tools where they can do the types of edits Kevin was talking about, where we can do the types of flags and really be able to pull out those ones that we really need to take that closer look at and be able to really get those in real time, that's gold. And that's going to make a real difference to the program. But Kevin, I'll let you build on that.
Yeah, the analogy I always use, Claims Core is hugely important to our organization and the future of Medicare. I think the analogy I would use is it's like the highway that all of the rest of our systems run on, right? So I can build a Corvette or something super fast car that's speedy, but if I'm running it on a pole with a road with a bunch of potholes, it's not going to be successful, right? So the claims processing system is really like the highway that everything at CMS runs on, and increasing that capability there makes all of our capabilities better and improved. And it's a hugely important effort for the future program integrity and Medicare in general.
That's awesome. Kim, you spoke about the White House Task Force. Talk a little bit more about how collaboration plays a huge role in the work that you're doing and setting that tone across the board.
Sure. It's been really, it's been a great thing to do the task force. I mean, obviously, it's helpful whenever you can get somebody at the vice president's level to pull everybody together and make them all work together. So that's huge. But it also allows us to see and hear what other agencies are doing and how they're addressing their fraud and abuse problems. And so for me, what it's helping me determine is, oh, did we think about using this approach the Treasury is using, for instance, to go after tax fraud? Or, yesterday, the Small Business Administration announced a bunch of actions that they were taking about people who had taken advantage of the Paycheck Protection Program and stuff like that, and how they were able to determine who those people were and take action against them. I think the more that we can learn from our partners on that, it's great. But what I also like about it is it forces us to think together about how to solve problems. A great example of that is yesterday's announcement in Ohio. The administrator was there along with the acting attorney general, as I just mentioned, the Commissioner Loeffler from the Small Business Administration, et cetera. And they were all talking about federal state partnership to fighting fraud and how it is that we are working in tandem with the states. Each of them had a different perspective. Obviously, what SBA does is different than what CMS does. But what was really cool is it allowed us to really get everybody focused around how is each of these federal entities working with not only individual states like Ohio, but just the states in general to really be able to look at the Medicaid War Room we've talked about. Yesterday, we announced that we are partnering with Ohio on 49 suspensions of home health providers, some of whom had been identified by the National War Room, the Medicaid War Room. Two of them were Ohio providers, Bethany, who Kevin mentioned. Bethany and the team team had identified, and we had referred to Ohio. So now they're taking action against them. So I think that whole government approach has been really helpful, because in the past, we were all fighting the war within our own silos, but we weren't leveraging our resources to the extent we can. Now we are on a weekly, if not daily basis, talking about how we can all help each other. And I think I'm very excited, as a preview for your listeners, June 24th is the National Healthcare Fraud Takedown Day. And I think you're really going to see, last year was the biggest one ever. This year may make that one look small. So the fact of the matter is, we're super excited about the potential to be able to really work with OIG, DOJ, FBI in real time, in tandem, to address these things in ways that we just couldn't have without that.
That's fantastic. So as we look ahead, can you give us a preview of these upcoming pilots that you have and how they'll shape the next phase of the CMS crushing fraud strategy?
Sure. So one of them, I'm going to let Kevin talk specifics. I'll talk big picture, and then he can kind of talk, because we haven't announced all of them yet. But we did announce a new one yesterday with Oracle, which is allowing Oracle to work directly with the state of Indiana to look at real-time Medicaid claims data in Indiana. Again, we have what's called TMSIS data right now, which is self-reported data from the states. It's claims data. But unfortunately, it's a little bit garbage in, garbage out, right? You know, the consistency of the data is not always the best. The time lag with the data is a minimum of 4 months usually. And so that makes it really hard to do what Kevin and the team have been able to do on the Medicare war room, which is actually stop something before it goes out the door. With TMSIS, we're only looking at things after the fact. Through this new Oracle pilot, the idea is, and I'll let Kevin talk about it because he helped develop the use cases, the idea is to test some of the fraud, waste, and abuse tools that Oracle Health has developed against real-time Medicaid data and see what we can find. But with that, I'll hand it to Kevin to give a use case or two.
Yeah, sure. We're really excited about the Oracle partnership, and the overarching goal, I think, is the perspective is, once again, moving from pay and chase to stop and caught, or detect and prevent, and also develop something that's transferable and usable for other states. We partner with Indiana. They've been great partners in this, develop something there. The use cases are, as you can imagine, given the themes here, taking real-time or near real-time Indiana data and then using that data to identify vulnerabilities and eventually prepayment actions that can be taken, think edits and so forth, that allow us to stop the money to go out before it happens, and to take the lessons learned from Indiana and scale them and transfer them to other states. And then the other, I think the key word that Kim mentioned was the collaboration aspect of it too, to build tools inside of this that facilitate that collaboration amongst the many different stakeholders that have a role in Medicaid program integrity action. So really excited for the results of this pilot.
That's very exciting. Kim, are there any other pilots that you guys have planned that you'd like to share?
I can talk big picture. We haven't officially announced all the others, but we have another Medicare nationwide pilot that we're doing with a big name that you'll hear about soon, maybe at the takedown in 3 weeks. But again, similar sort of thing. That one is to help us be able to look more at the totality of things that are determining the affiliations that people have. So part of the goal there is to help us be able to look at, you know, can we use utility records, tax records, real estate records, et cetera, to be able to tell where these people are. One of the things we've had a lot of luck with recently has been partnering with the Department of Treasury, looking at banking data. And so we were able to look at the EFT, the electronic funds transfer information on where the MACs, the Medicare Administrative Contractors, pay claims, and actually find affiliations based on common banking numbers, things that we wouldn't have normally been able to see before. So we're really excited about that. And then we're going to be running some of these advanced approaches that some of the outside entities have done, and run them and see what they find different from what Kevin and the are finding. And so that's good. And then we are looking to do another 2 or 3 state specific pilots, because we want to do more like we're doing with Oracle and other states, but with other companies. And the idea is it's a smaller version of the chili cook-off, I guess you would say. Maybe we'll call it the bake-off in this case. But nonetheless, the idea is to really look at a handful of states with a handful of different approaches against it. And then at the end of the summer, be able to have Kevin's team and maybe one of our independent outside contractors take a fresh look and say, what did we learn from these? And then where is it that we either want to develop our own internal custom built approach to some of this, much as Kevin and the team already have, or what are the things that are off the shelf that worked really well that we're willing to invest in and maybe use in more than just one state, like Kevin was talking about. But Kevin, feel free to jump in. We haven't officially announced the names of everybody else. I'm being purposely cryptic, but we can give at least a little idea of what we're trying to do.
Yeah, and I maybe just one more to tack on there. We're really excited about some efforts to infuse the war rooms are very technologically heavy as is, but now that we've built out processes that really work, we're also looking to see what we can do to just infuse technology from end to end in that process to make everything as seamless and quick as possible in both our Medicare war room and Medicaid war room.
That's awesome. So in closing, what would you like to share with our listeners?
Kevin, you go first and then I'll wrap it up.
Yeah, I could just say what a great year and a half it's been, that we're, I think, being very groundbreaking in many different areas, both in terms of bringing on great federal personnel, partnering, doing the most high value partnerships with industry, and doing things that I think is very valuable to the American people. And one of the things that just comes back to me is when we do these things, we're helping people. Like, there's victims in this. And at the end of the day, if we stop fraud, that usually means we've allowed somebody to get health care that they need, or prevented them from getting something that might injure or hurt them. And that's a really just meaningful place to be. And I'm fortunate to be here. So thank you, Susan.
Congratulations on that, Kevin. Kim?
So I think for me, part of the goal in coming back, when Dr. Oz called me and I was a hard no on coming back, not because I don't love CMS, but because I really loved having a life. I was like, no, I don't think so. And he's like, what is it that would get you to come back? And I was like, honestly, the chance to completely upend how we do program integrity. I think that the CMS has the ability to be the government leader in program integrity. We have the biggest dollars. We have the biggest bully pulpit. We have not had the support or the focus to be able to do that. And he said, if I make that a priority, will you come back? And I was like, yes. And here we are. But he's really been true to that. And so I think, as I think about it, what I'm constantly thinking about is, what is the legacy of all this? What is the 3 to 5 year legacy? I hope people like Kevin are here for many more years. I know I have a term limit, so to speak. When the administration is done, I'm done one way or the other. Now, if I'm back for term 4, who the hell knows? But sorry. But the fact of the matter is, for me, it's sort of what is success. And as Kevin mentioned at the beginning, for me, that's, better data, smarter tools, and stronger authority. I want to make sure that on the data front, that we are getting real-time cross-program data sharing between Medicare, Medicaid, and the exchanges. We have a ton of gaps right now, and that means that providers suspended in Medicare can sometimes still bill Medicaid. That shouldn't be possible. On the tools, we need to use AI and machine learning. We need to use it at every decision point, from enrollment screening to claim adjudication to payment release. We need to be using it much more effectively and much more wholesome. The war room's doing a great job, but we need to do even better. And then we need to be the model for the industry partnership that we're building through things like the chili cook-off that I mentioned through a lot of the other types of things that we're doing. We need partners sharing better data with us and making sure that they're doing that with smarter tools and cleaner authority. At the end of the day, if we do that and we are able to get it so that we can stop dollars on the front end, winning to me is extending the life of the trust fund by even a couple of years. Every single year that we can extend the life of the trust fund and make sure that beneficiaries are not getting taken advantage of, that's a win. And so my hope is that at the end of 2028, when this administration ends, whatever happens next, that we can walk away by saying we have fundamentally changed how CMS does this, and CMS is the leader in program integrity.
I love it. Kim, Kevin, thank you both for your leadership. Thank you both for caring so much about this mission and making a difference every day. And thank you so much for joining us.
Thank you.
Yeah, thank you, Susan.
This concludes today's episode of the Fed to Fed podcast. If you enjoyed this episode, please don't forget to subscribe, rate, and leave a review. Your feedback helps us continue bringing you thought-provoking conversations with the brightest minds in government technology. Stay tuned for our next episode, where we will continue to explore opportunities to harness the power of technology and explore what's next in developing a more innovative and efficient government. Until then, this is the Fed to Fed podcast by GovTech Connects. Thank you for joining us.